Hello. Working, just checking. Hello, so I'm Sarah. Thank you for the introduction. We're here to talk about women in health innovation. Kicking off, I think, just to give all of us and the audience a bit of a deeper understanding into what we do and why we do it. I'll kick off first. So I'm Sarah. I am a consultant speech and language therapist. I have a practice in London and in Dubai. That means we work with children who have autism. We diagnose autism, we treat and provide programs for schools and families. And we offer therapy sessions in clinics and homes in a very dynamic approach to what the child needs. It's really important, as we know, communication is key, and at SL Therapy, we really want to ensure that every child reaches their communication potential.
Nice. Hello. So my team and I are transforming mother-daughter relationships. The mother-daughter relationship can be very difficult. It can be beautiful, it can be heartbreaking, everything in between. So we created an app that focuses on promoting intentional bonding, healing, and growth for mother-daughter pairs. And it's the first of its kind in the United States. So that's why I think it's innovative. Thank you, Sarah.
Hello, everyone. My name is Maisa. I am from Brazil, actually. I'm professor in research. I am developing one research about cancer stem cells. We are trying to understand the relationship between the stem cells and the hypox microenvironment with the exosomes, about the secretome, how it's improve the normal tissue for become cancer tissue. So I came to Dubai. I came to Dubai to develop this research and to try to understand about this. But I am research about cancer stem cell science, my master degree, and it's makes me very curious about the future and the new techniques for the treatment and the new forms of the diagnosis of the cancer. And it's very excited me about this research, and I think I can contribute with this one, like a woman in the research as well.
Hi everyone, my name is Firaoli Adam. I am a respiratory therapist and founder of Mawadda with my co-partner Yasmin. As a respiratory therapist, we faced firsthand the struggle of not having disposable isolation hijab, as is provided for everybody else when it comes to disposable gowns, gloves, and everything else that was available. However, we felt like we were left out, especially during COVID and pandemic. Everybody got familiar with the word PPE. So first-hand experiencing that is what led us to founding our business Mawadda, where we try to make modest healthcare clothing available, and our first pilot project being disposable isolation hijab we call hygienic hijab. So yes, I can go into it a little bit more later, but that is how we came about with Mawadda.
Wonderful. So really interesting to get a bit more of an insight into what we all do. And I think something we were talking about earlier as well is, you know, you've devised an amazing app. Your business has come out of PPE. How has COVID, how did lockdown affect how you decided to pursue your idea, your dream, your business?
So during COVID, I was working at a psychiatric hospital as the director of IT. I didn't have any plans on hopping in to do my own business. I was very comfortable. I had a big salary. I have kids. I have I have bills to pay. So I was not planning to jump into a startup anytime soon. But my team supported thousands of teletherapy sessions during the pandemic. And we watched how the outcomes for those patients were just as effective in the mental health care that they were getting via their iPads, on their PCs. I saw the effectiveness of it, and I was passionate about the mother-daughter relationship, and I thought, now is the time to jump. So the pandemic motivated me because I saw how effective it was. And that's how I got into it.
And for you as well.
Yes, actually very similar to what Lacey was saying. Business is not something that we thought about going into or creating. We were just like, with pandemic, as a respiratory therapist, we were frontline workers, and working in the hospitals, it was really tough trying to, get used to the way to run the ventilator, depending on the different patients, how to be, proactive, trying to prone the patient before they actually get on the ventilator. So we were just focused on that, but at the same time, we also were being affected. As when we go to patient's room, they have everything available to us. We have the mask, the gown, gloves, even shoe cover, but we wear the same hijab throughout the 12.5-hour shift. So we were just talking to the manager, trying to put a temporary bandage on, where we're just like, hey, if we have COVID unit, please make sure we don't go to NICU, make sure we don't go to cancer center or anybody else that doesn't have COVID, because we don't want to spread infection. Like, we trying to help these people that's already not doing well. So we also brought extra hijabs, so we can try to change if we have to go to those units. And also, we don't want to bring anything to our family. So that's what we're doing at that moment. But as the time went on and COVID was like staying here for a year, and in 2021, me and Yasmin both decided to do a travel where we go to state's emergency. They ask for RTs where they needed the most, and we started doing that. And at one of the hospital while working there, we saw they had beard cover, as Yasmin explained it yesterday. And then we're like, they even have beard cover, why can we not have something to protect us, And we looked into it, trying to buy stuff from online, as we were trying to protect ourselves, not trying to come up with a business. And there was nothing. There was a story about a sister that talked about it, how this is needed in OR, but again, we couldn't find nothing to purchase. At that time, we just decided, what? We have to do this for ourselves. We can't wait for somebody else to come with or save us. We have to save ourselves. As we both had family members that were still, going into healthcare field, we're just like, we need to do something for the next generation. We don't want them to go through what we went through. So that kind of motivated us into building our business, where we went into, researching how to register, simple as that, because we didn't come from business background, going through the FDA, since this is something that's going to be in a hospital setting. It was a lot of work, but at the end of the day, we had the community that were supporting us because they knew how much this is needed. Because it's not only for healthcare workers, but it's also for patients. So the people that are affected by this are obviously women. So it's just like, okay, somebody finally spoke for us. And one of the questions that people ask us is, what do you guys wear right now? When we talk about it, and we're just like, we wear the same thing we wear right now. Like, we don't have anything available to us. So for that reason, we got into where we wanted to be right now, where we launched last November, and we currently have about 4 hospitals that we sold to, and we are sampling phase with like about 13 hospitals right now. And we kind of open up for, having investors for us to upscale our business. That's where we're at right now.
Wonderful. I mean, we found that as well with SL Therapy London and Dubai, that we'd always offered online sessions, Zoom sessions. There were other providers are available. But when lockdown hit, that was it. Everybody was at home. And what we found, that some of the young children that we work with, they have anxiety disorders, situational mutism, which means they have an anxiety around talking, and actually online sessions work really well for them. So the mini research we did within our clinical team over the 2 years actually showed that some of the conditions we work with actually benefited better and made more progress with their treatment through online than in person. So some of those approaches have remained and continue even now, which also means it opens up our services across the world. You can be in any country to receive SL therapy care rather than having to be face-to-face in a clinic, which of course always has its place, which is why there are clinics still there. But that was a big shift clinically that we saw in lockdown. And if COVID hadn't happened, we may never have experienced it or gathered that research to see that it works. Did you find that COVID lockdown affected your research or how you worked?
Yeah, actually, in this time of the pandemic, we didn't have too much problems. I mean, about the research, just it's make the research get a little bit delay because we had to stop everything about the another research for start to looking for the new forms of the diagnosis of the COVID or the interaction between the cells and how the virus could to come the cells or how we can could to find these good tests for diagnosis. So we had to stop every day research about another things and to start research about COVID. So it's get for us a little bit delay of our research about cancer and everything in the laboratory which one I worked. But we were a little bit safe inside the research laboratory because we didn't work with the samples of, contaminated samples or directly with the patients, and it was a little bit safety, but too much work has come in that time, and even the supplies of the laboratory has become less, and we had problems with this one as well. It's get too much delay for us, but I'm very happy about how the science could to find out the tests of the diagnosis and the vaccine fast, a little bit fast, in front of the pandemic. So I am very happy about the research, how they could to contribute with this one. But it was hard moment for everyone, I think so.
Let's talk about research. You're obviously from a research background and you've shared with us today. How in your businesses and worlds are you using research or want to use research now that you're developing your products? Take it away, Lacey.
Yeah. So for us, there is not a lot of research or data available on the mother-daughter relationship. There's a lot on parent-child, there's a lot on spouse, marriages, the mental health, but specifically for the mother-daughter relationship, there aren't validated measures. So research for my business, we're very interested in getting our metrics from the app published and validated. So when a mother-daughter first starts with our app, we baseline their relationship with 8 questions that my team, I have a clinical advisory board, they came up with 8 questions to find out what is the baseline health of the relationship. And so we ask those same questions 3 months after they've been using our app and they've been seeing their therapist regularly. And then another 3 months, we ask the same questions again. What we want to find out is the effectiveness, but we also want to validate those measures so that other facilities, private practices, clinicians can use those measures to see what is the health of the mother-daughter relationship and how can it improve. So we're interested in getting into the research.
Is it effective as well for insurance providers?
Sure.
Yeah, just thinking about that. I mean, I'm involved with a clinical study at the minute looking at a communication coaching program where the families then complete digital exercises to get the data, the metrics. I'm not technical, but the tech team deal with that side. and looking at them making progress with their communication through this mode of delivery, which again is what came out of COVID and lockdown, and having a parent coaching approach and having that efficacy of the program. I know clinically it works, but having the research data there is really effective then in pushing the program, or the app in this case, forward.
Yeah, we get asked every day if we accept insurance. And so I also look forward to our research and our outcomes allowing us to get insurance partnerships. The app to download right now is self-pay. So the mother-daughter pair, they pay $280 to get started, $220 a month. For some people, they can't afford $280, right? If you're not going to prioritize your relationship in paying for this app. So you're absolutely right. The research is going to help us prove the effectiveness to be able to get insurance reimbursements for these mother-daughter pairs. So it's important.
Do you find that?
So for us, when it comes to research, is so they for sure know this is something that is needed, knowing that is not available. Is more of what we faced is some hospitals don't know exactly how much they need based on how many patients or healthcare workers that they have in that community or that comes to that hospital. So that's something that they're working with, people who work with basically the imams in a hospital. So sometimes they might have the data, how many people from that faith kind of comes to that hospital. So they're trying to find out exactly how much they need. And some of them are going based on just purchasing whatever is the mean, average, and then based on that, they will just go up and down. But knowing that there is a little over 3.4 million Muslims living in the United States, and half of that population, if you think of it as a woman, and then we find out even, gowns, basically in a hospital, they change 2.5 times every day. So it's exactly
2.5 times a day?
Yes, so you doing that calculation is a lot of need. And knowing that this is, to kind of stop, infection spreading, is also patient satisfaction and diversity inclusive. So this is definitely something that is needed, and people are aware of it, and we are, so thankful for that. It's just now taking it to the next step of, making sure every hospital have this available for them.
So you're obviously on an app which you can find on your phone. Do you have your hijab with you? Did you bring it with? Did you bring what's the word? A speech therapist who's lost her words. It's not very good, is it? Prototype. Thank you, Lacey. Lacey, you take it. You know what I'm trying to say.
Yes, actually, we brought the sample, but forgot in the hotel. So we'll bring it by tomorrow if anybody wants to see the sample and the material. So this is definitely made from the same material as the gowns. We just had to make sure that is also, hijabi standard, make sure it's not see-through. Also, a lot of surgeons and pharmacists explained to us when we did focus groups and studies that the fact that they want something that is breathable, because that's important to them, because they can be in surgery or mixing medication anywhere 7 to 9 hours and sometimes 11, so they're that's really important to them. And our manufacturer is based in US, is in New York. So we just make sure everything is around us to kind of make sure, we have access to them at any time and is reliable for any shipments.
So we talked about why we do what we do and what inspired us in terms of the environment. Just throwing it out there, as I'm going to do throughout today, no, not singling anybody else. Is there any person or woman, seeing as we're talking about women in health innovation, that inspired you throughout your career and your journey to where you are now? Lacey, you just...
Yeah, I'll go first. So definitely for me, it was my mother. So the entire business that I've created is around the mother-daughter relationship. That was inspired by my mother. Our relationship, so I was given up for adoption at birth, and then I didn't meet my mother until I was 18 years old. And then we had a beautiful 10 years together, and by beautiful, I mean it was up, down. There's guilt for giving me up for adoption. There's resentment on my side. We had lots of feelings. And it wasn't until she got a stage 4 lung cancer diagnosis that we got very intentional about our relationship. So the oncologist said, even with treatment, you've got 9 months to live. And so my mom and I said, okay, hey, we have some forgiving we need to do. We have, you know, some things we wanted to heal from together. So definitely my app and me wanting to transform other mother-daughter relationships, nudge them to get closer, was inspired by my mom. So.
Yeah. That's amazing for sharing. Strong start. Strong start.
Well, I don't know how to go after that, Lacey. But definitely, I will say same. My mom has been my inspiration for everything I do. Since I was young, she always believed in me. She didn't mind, you know, where I went for school or what I studied, as long as it's something that I love. And she's always been like, you know, she loves helping people and is always like patience with everybody. And her presence in my life and her being my role model is something that made me feel like I can do anything that I set my mind into. So it's just that her giving me that motivation is what got me through even the hard times going this, making sure, you know, her and everybody that looks like her and my sisters don't get affected like we did, right? So this is like, yes, my mom is my motivation and my role model, but at the same time, it was all the women in our community that didn't feel like they had somebody, you know, had a voice and spoke on behalf of them. So me doing that is not only just me being in public and kind of doing it for myself, but it's also for my community and the women, you know, that wear hijab in the world, basically.
Yeah, for me.
Yes, another mother. Love the pictures.
Yes, for me, it's not different. I think for us women, the mom, it's the more inspiration in our life. So my mom, it's my inspiration as well. Mostly in the beginning, when I was starting stud and when I was looking for what I want to do of my career, and she always supported me. But for me, what more inspired me to go to this career and choose this to be professor in research, it was because I would like to prove to my mom I could to do it, and I could to be more and more, I could to get more and more knowledge, and it was which gave me too much force to continue this long way. And now currently my inspiration in research is the Dr. Neil Jordan, who published more than 70 scientific articles about the stem cells, normal stem cells for the different treatment forms, because I believe it's the future of the health and all the treatment for mostly disease. So for me, he is inspiration of the how we can treat mostly the disease, important disease as a cancer and as a mentality disease, and so much things we can treat with the stem cells.
Wonderful. Well, I'd have to say my mother as well. It just came to me as we were talking about it, and actually the whole purpose of what I do and having SL Therapy London Dubai exist is really down to her. I have a brother, he's a year younger than me, who has Down syndrome. He was born in the 80s, and it was incredibly challenging for both my parents, and I saw my mother steel herself and crack on with it. Very London phrase. You're going to laugh at that. We were laughing about the differences between American and English. And I saw her support him, guide him, teach him life skills, take him to speech therapy, which is where I first saw this woman playing games with him, and I was getting very jealous why I wasn't playing games as well. And it's the reason why I wanted to set up the therapy company and support other families, not just with the therapeutic side, but also supporting them through that special needs journey. That your child now has a diagnosis, what does that mean? Well, actually, that's okay because I'm a sibling of one. And so it was my mother, who now, 6 years later, we have a team of 10, 3 clinics in London, 1 in Dubai, supporting all those families throughout the whole of the journey, which is what I'm really proud about. So I think a big clap to mothers.
Yeah. And I think you see the theme, right? So this panel is Women in Health Innovation, and women, we have emotional ties to our work. Yeah. We have a lot of passion around changing the lives, and that's one of the reasons I think it was hard for me to stay at the hospital. Once I got that emotional drive and I knew I wanted to go forward, when I was at the hospital, I had lots of really good ideas, and I would come into these big meetings. The executive team was mostly men, and so I would have these ideas, and I did feel a little bit like either my ideas were too emotional, you know, they wanted very business, linear, okay, how are we going to affect the patient? And I was always thinking about how does the patient feel, and, you know, what's their story, and how can that be better at the hospital? And so I think it's just, you know, the theme that I heard with all of us is that we have emotional ties to our work, and that can light the work on fire, that can make it exciting, and it can push it forward, but not everyone appreciates that. And I think we have to find spaces where we can be on fire and we can get emotional and we can, you know, feel that purpose that way.
Which is why we're all set up doing our own thing. Absolutely. And I think it's the difference between understanding that that emotional drive is a positive as well. It's a positive thing to push forward. And I think also, I mean, I used to work in schools in the NHS, and I do think being in certain institutions as well can make it tricky to go in with new ideas. So having the confidence and the grit to set up and be in, I can't say the word innovative, I can't say it. I'm a speech therapist. I really am, I promise. And be independent and take those ideas and turn it into something real and tangible, which is what we're all doing, which is brilliant.
And I think also when I said earlier that people is like, wow, this is not available, and they look at it as in like, you know, this is something that everybody should have known is a problem. But the thing is, unless the problem affects you, you don't know that this is a problem. Somebody has to tell you sometimes. And I feel like as a woman, we have a unique perspective, and it's something that affects us. And, you know, we just have to speak up sometimes to let people know, hey, this is what we're facing, and we need help solving this issue. I remember working with a male respiratory therapist, and we were going to isolation room. It was droplet. And as we were both grabbing, you know, our mask to put on, and this is before COVID. So I picked up my mask and, you know, kind of make sure like I broke the string from both ends so I can tie it. And he's looking at me like, what are you doing? You know, and I'm like, hey, you're privileged. You have your ear out. I don't, you know? And, excuse me. And this was pre-COVID, so there is nothing that helps you, you know, to put up your mask so, you know, your ears don't get, you know, during COVID, we wear masks like for long-hour shifts, so we had something that would help us with that. But before that, we didn't, and so I have to tie it on top of my hijab. And the reason, even though he was a Muslim, but he was a man, and it didn't affect him, so he was just confused looking at me like, what are you doing? And I'm just like, you know, you should be lucky, you're privileged. You know, this is what I face all the time. So sometimes they have to see it from, you know, your point of view and kind of show them, and that is really important. And if we get a chance, I feel like as a woman, we can do a lot in this world and bring in a lot of changes as well.
Right on, right on.
Goodness, I'm sorry to pause. I was just wondering how much time we had left, and I didn't realise there's the minutes in front. It's flying by. Wonderful. So is there anything now, looking forward, that you think is the next leap, the next step, building on from what we've talked about today, stem cell research, you know, investigating the mother-daughter relationship, you know, devising products for women that they need. I mean, 4 of us sitting here, I will include myself, are really driving it forward. Is there anything in the future that you've kind of got your eye on or got a little light bulb thought in your head?
Okay. I am very passionate about virtual reality. And so I always think about, okay, what can we send to the patient or client's home that will make their telehealth or their teletherapy more engaging? So instead of just having your video session through your iPad, can we give you a more immersive experience? So I would like to see where that goes in the next 5 years. You know, what immersive technologies hospitals begin to use, especially psychiatric hospitals, you know, where you have, if you have inpatient and, you know, they have very hard therapy sessions where they have to talk about a lot of trauma and a lot of, you know, sensitive, hard things. How can they get relief, especially if you're going to sessions back to back? So, you know, can we use immersive technology to allow the patient to relax? You know, like in between sessions, they want to go to the beach. You know, they want to forget that they're at a hospital. Can we either use VR or the projection mapping inside of rooms to take the client or the patient to a rainforest, to, you know, give them a different experience that allows them to have a break and then resume treatment. So I'm very interested to see where immersive technology, virtual reality, augmented reality, where it goes in the next 5 years.
And it's coming. I mean, it's already here.
Yeah.
Yes. Absolutely. That's really exciting. And I think that also plays into our work as well, the therapy sessions that we do, that's something I've got my eye on as well for the future, and just making it much more functional, dynamic, and accessible for what they need. Absolutely.
So for the future about the stem cells, I think so it's coming already, and actually it's workings here in few countries around the world. For us in Brazil, it's far away. We just are working with like a research is not with the clinical research or the treatments, but here it's possible. So it's the future right now. It's happening right now. But I think the challenge for these things, for it's become the most important treatment, can be like the sexism of the profession, the healthcare professionals and the patients. Sometimes they don't believe this. The innovation treatments can help them or can improve the old treatments or old tests of the diagnosis. So I think it's the most challenge we can pass out for put this kind of treatment in all the market around the world, mainly in the poor countries like Brazil and like another ones. But I think it's coming fast, and it's already our works in countries like here and like USA and other countries around the world. So it will come, and it will be the good future in few years.
Okay. So what's next for our business Mawadda is making sure, you know, we see this product at every hospital, make sure it's available to every patient and, you know, healthcare workers. But the amount of attention it just got us realizing that we have to make sure we're ready for the next step. So that's why we're like now open to investors so we can scale our business and also work on the next product. We have a lot of also like healthcare workers when we go to different conferences coming to us saying, hey, you know, this is something else that we need, you know, you guys gonna work on this, and they even like, they bring us ideas saying, you guys are already in that field, can you please help us with this? You know, I wanna go in that field, but you know, I can't wear this or I have to wear this. So, and it's not something only that we got from United States, but also like, you know, outside. Like we remember we had a lot of DMs from people in UK, even India, Mexico, and we were just like not expecting it. Yes, so like it was the attention it got. Just, you know, we know how much is needed, but hearing it from, you know, everybody else, it just kind of motivates you saying, okay, we want to make sure we're inspiring the next generation and that they have everything available to them and they're ready to take on the world and make more, you know, big difference as well.
So a long list then for the next couple of years of products. Look forward to that. Wonderful. Well, we're nearly coming to the end, quicker than I thought, in a lovely way. It's been great. It's been wonderful to sit here today and share our discussion with you. Is there anything that you want to leave people with? Any last thoughts? Lacey, why not start?
So for me, I flew 15 hours to come to this conference. I came all the way from the US because number one, I love the region, but number two, I needed to make connections. I want to make connections with people that live in other regions. So a takeaway from me is if there's anyone in this room that's listening now and you have the ability to help me bring a pilot to your region, whether it's here, whether it's your home country, a pilot for our app would be wonderful. So the takeaway for me is if you've heard what I'm doing, if you've seen it and you're interested, please come talk to me before the end of the conference. I want to leave. I want to go back to the US with as many contacts, as many connections, as many ways into the market as possible, and I would appreciate it.
And you're looking for mother-daughter pairs for the pilot study?
Yes, in each region we would do 50 families. So we'll have 10 therapists. Each therapist would get 5 families. We'd do the pilot, we'd measure the outcomes over 9 months, see the effectiveness, and if it's effective, then we would do a full launch in that region.
Wonderful.
Yeah.
For me, to be in this conference, it's the realize of the dream, because I never in my mind could dream to be here and research or sharing the knowledge with the high professionals like you and like all the participants of this conference. So I am very glad for be here, and yes, for me it's amazing, and it was wonderful to be here and to share with you all the information and all the knowledge.
Yes, just like Lacey, we took 17-hour flight and came here, so hopefully, you know, we leave with something, and that is, you know, first of all, everybody had different topic they talked about here. We learned a lot as healthcare workers as well, so thank you for that. And if anybody feels like their hospitals need our product that we were just talking about, or want to see a sample or see how we can help your hospital, you know, make sure there is diversity inclusive, patient satisfaction, and making sure, you know, there is no infection spreading or any other topic that you want to talk about. We are available. We would like to meet as many people as we can. Also, if you guys know anybody that wants to be an investor, that's interested in the kind of business that we're in, we will be available. Please reach out. We have our business cards too. So yeah, definitely. Thank you for your time and everything.
And Sarah, what do you need from us? What do you need from this crowd?
Because I feel very egotistical bringing it back to me. So thank you for asking, Lacey. So obviously my company focuses on therapy for children with communication difficulties and disorders. Like I said, special interest in autism, anxiety disorders, but any kind of communication difficulty difficulty, that is what we assess, diagnose and treat. So anybody who'd be interested in talking further about that in relation to medical centres, clinics, schools, or if you know any children that you might have concerns about yourself, very happy to have a conversation with you, make connections, and as we all said, take it forward. So I think from London, Houston, Brazil, Minnesota, it's been wonderful to spend time with you today, and we look forward to speaking, continuing this discussion in the networking session or outside. So thank you so much, everybody.